So, Doctor, I think we, of course, caught up before today's conversation. And this is a difficult topic that we've kind of picked up, right? Because uh, engagement means a lot of different things to different organizations and demographics. I wanted to start with one data point from one of the recent studies that we did, which was linking organization or rather employee engagement to productivity. And there was a bit of a dichotomy that we saw, right? The data showed us that 80% of executives obviously acknowledged the need for employee engagement, and they saw that correlation with, let's say, organization and team performance. Only 64% said they're able to measure it, or they have systems or, let's say, processes kind of triangulated to measure things. But unfortunately, only 20% said they're actually able to see cause effect, right, between what they want to do and performance. So there seems to be obviously a lot of disconnect sometimes between what we want to do in the, in the form of engagement and what we see as outcome. So I think the first thing that I really wanted to talk to you about, get your inputs, insights, was how do you look at, this dichotomy, and how do you see this balance, right? Because on one hand, you can say that we'll take everyone to Goa and we'll give them iPads, but that's not probably going to result in productivity, right? There might be a temporary uptick, but is that sustainable? So how do you look at this dichotomy, and if you have any insights on this linkage between engagement and productivity?
Uh, I come from a completely different industry. I think most of you are from the tech industry, and mine is a completely different. I've never worked in any other industry apart from the healthcare. And I think engagement is to be meaningful, and especially in healthcare, when we have disengaged workforce, uh, it definitely leads to poor outcome. Patients die, as simple as that. So we just cannot afford to have a disengaged workforce at all. And the engagement has to be, they need to find some kind of a purpose or a meaning for the work that they do. And this has to be aligned with the organizational vision, mission, and the objectives of the organization. And I'm fortunate to work with Dr. Devi Shetty, who is able to articulate the vision and the mission of high quality and an affordable for the masses. So this is very important for the employees, for them to be aligned to this, and every role has to be aligned to the organizational agenda. That is very important. And it doesn't matter how small the role is. I mean, I heard some of the speakers in the prior, this one saying that we are a team of individuals. Even here with us, all the doctors are on an individual professional contract. They're not even employees of ours. But at the end of the day, we all come together to deliver the quality of care which is needed for the patient. We are there for the patient. The patient is the most important thing for us. But at the end of the day, without the doctors, we are not able to deliver. So we need to take care of two stakeholders here, the patients as well as the clinical team. Not just the doctors, the entire clinical team is very, very important for us to take care. So it's very important for us to keep engaging with them and keep it there. It's very important, especially in this one, if we want to, if our stated goal is to have very minimal or zero, hospital-acquired infections, there are many causes for, patient-related and risk factors for that which could happen. But then there are certain controllable causes for which you can, need to work. Then you need to engage even with somebody like the janitor. You need to make them sure that, that their cleaning is very, very important, because any body fluids, whether it's blood or urine or whatever it is one of the best media for growing of any organisms. And anything which is not done properly will affect the patients and the outcome of the patients, and productivity and the cost and everything else goes up. So I think we need to, we cannot ignore anyone in the entire organization. We need to engage with all of them. Yeah.
Thank you, Doctor. And I think most of us probably are attending an event of this sort in person after 2 or 3 years. But I'm sure your side of the story is so different, because for the last 2.5 years, the clinical staff example that you mentioned was probably working more and in more negative environments than probably they were, right? As you're absolutely right. Most of the people here, I think, represent technology and IT hub organizations. So when you look at, let's say, the two waves, right? Obviously, tensions were high and workload was high. So how did you ensure that there was a balance? But how did you also ensure that the same things that you spoke about, right? Employees, talent having a sense of purpose, a sense of meaning, and that kind of permeating through the organization. How did you ensure that during these difficult times?
Uh, you need to walk the talk, and there is no point in telling somebody you need to work in the COVID ward when you are, as a leader, sitting in the comfort of your home. So what we did was, even at the first lockdown, the major lockdown that happened, we hardly worked from home for 2 or 3 days. We were all back in the offices, and we were all working from the offices. And we used to conduct meetings inside the hospital, wearing our gears, and we used to that just to make them aware that we are there with them. And a lot of meetings used to happen, and if you have to conduct a preparedness for the ICU, we used to wear the gears and go and work in the ICU and have the meeting and coordination meetings in the ICU. So the teams were very much in aligned that the leadership is part of this entire thing, and were willing to go with this entire thing. But then it was a big, the purpose for which they were all being trained for. There was a little bit of fear initially because the vaccines were not out and things like that. But I think they did some wonderful job in this entire, this one. I mean, you cannot even imagine the kind of things that, people have seen. The things that, nothing prepares you in life to tell somebody, call somebody and say your loved one is no more. Then nothing prepares for you. You can have all the best of education. Many people break down, they just cannot take it. And the COVID, we've seen deaths which, nobody has ever seen. Maybe we've seen deaths of what we would have, in a period of 2-3 months, what we would have seen in our entire lifetime of 20-30 years of clinical practice. So this took a big toll on many of our staff, but then constantly engaging with them, supporting them, working with them, giving them the support and giving the protocols, explaining the protocols to all of them, and how this one, because the first thing we took as a leadership team with Dr. Shetty and all of us was to ensure that not one of our staff should, suffer and die because of caring for somebody else. And that is what we went all out and took care of every one of us in the proper way. And those were the days when, there was shortage of PPEs, but then the government did a wonderful job and getting all those things done. But then it was difficult days, but I think the cohesiveness of the team, and that is what brought together. I mean, it is so crazy that doctors were down with COVID, admitted in the COVID ward, and very casually calling up and saying, don't worry, don't ask anybody else to come because I'm pretty all right, I'll take care of the rest of the guys here in this ward. So this is the kind of work that has gone on across this one. So if you really look at it, we took care of almost close to 300,000 patients during that period of time, running into innumerable patient days. But that is the kind of work. But then engaging, it's not about money. We cannot take them for trips to Goa and things like that. But, it's just not possible because we are into 24/7 kind of a stuff. But I think they need to feel that they're valued. Every one of them needs to feel that they're valued, and that's the most important thing. I think once you do that, I think they automatically fall into what the overall organizational agenda is.
Thank you, Doctor. And when you were describing the situation, I kind of went back about 50 years. I remember watching this interview of Field Marshal Manekshaw, and he was describing, the Bangladesh war. And I think one of the biggest takeaways he also mentioned was, walk the talk. So I think a really, really interesting takeaway. And I think as we look at employee engagement, linking into productivity, I think a lot of business leaders at times kind of try to put the horse before the cart and just say that to drive productivity, I will do, X, Y, Z, right? Probably one of the ways to then is probably flip that conversation and say that I will let, the outcomes be what they are and let them manifest in the way they are, but probably look at, how do I walk the talk first and lay that base. So really interesting. And I think just another round of applause just for the sheer grit and the resilience, obviously, that the organization has shown. Thank you. So I'm going to deflect to one of the themes that I think came up in the last conversation also, and would again like to hear your perspectives from the healthcare industry. When you look at the millennials and the Gen Z workforce coming in, one of the things that we have seen, and this is India-specific data, the preference in terms of all the different sectors, healthcare is somewhere in the middle, right? It's obviously not as attractive as, let's say, high tech or e-commerce or some of the organizations where millennials, Gen Z see, let's say, a lot more connection. It's also not as bad as something which is probably in the more manufacturing space, because that's the broader trend that we've seen, right? And healthcare is somewhere in the middle. So just one question I wanted to ask you is, as you look at new clinical staff coming in, the new breed of doctors who are coming in, right? As well as, let's say, some of the folks you have on the business side, are there differences, first of all, that you're seeing, in their orientation towards the industry, right? Because at the end of the day, it's not like other jobs, other sectors where you can flock around, right? It's something you commit for life. So I think it would be interesting to see, are you seeing that Gen Z millennial difference when it comes to the sector?
Yeah, I think it's inevitable, and we are seeing a lot of these things. We've, as trainees 30 years back, we have done shifts of 72 hours at a stretch and all kinds of crazy things. And we have worked with Dr. Shetty. I mean, he lived in the hospital for months together when he started Manipal Heart Foundation. And we've seen all those kinds of things, shifting patients out of the operating room at 3 a.m. and things like that. This generation are not like that. And those kinds of brutal conditions under which we were all trained doesn't exist, and I don't think it's right, and we cannot go back to that. I think there is studies have proven that, to have better outcomes, you need to have a sensible working hours. I think we need to follow all those kinds of things. But what is the other aspect of it is they also don't want to go for, there are certain not all of them, there are a few, people who are not interested in branches which will have night duties, which will involve, a different kind of a work life, which will not bring about a balance and all those kinds of things. And that is little disturbing, because as India is also aging and there is also a very young population, we have to take care of people who, as aging goes, obviously with aging, a lot of diseases will be there, NCDs and non-communicable disease, and you are going to feel a shortage. And this shortage is going to be tremendously felt in the tier 2 cities and in certain regions of the country where there's a significant shortage of healthcare workers. So this is, as a country as a whole, if you look at it, we have made a lot of strides. The ratios have all started moving in the right direction, but most of the people want to work in metros, in the big cities, and in the preferred works. And again, there's a big gap where the actual population is all living there. So this is a big paradox, and people don't want to go and work there. But if they work there, for us to put the right clinical team for serving the people there is a very big challenge. Getting the right people, giving the right results, and that is going to become a very challenging environment. So that is going to be a very big this one. But we need to engage with them. I've had people coming and saying, I can work any number of hours, Monday to Thursday, but Friday onwards, I am not there. But it doesn't work like that. So we need to have the right attitude in this sector. We just cannot afford to have a different kind of an attitude. But I think the industry has already moved to a very sensible kind of a working working atmosphere and work hours, so that we are able to deliver the right outcomes to the patients.
Thank you. And I think one of the most frequent conversations I've been having with a few of the hospital chains that I work with is, how do I move to a 5-day work week? I don't know if you have, but that seems to be the #1 demand in the organization. And I think it's becoming a bit of a cultural issue. So I think probably one immediate action item which, has started now.
That is something which we have no answer to, but I think a flexi hours is very difficult for us to work, especially in the clinical side. I mean, there are a lot of functional staff working, and that is easy to be done. The tech teams and the various functional things, they can go very easily to a hybrid or even a 5-day week. All kinds of things can be done there. But in the clinical side, it leaves very limited scope for us to work. Though there are a lot of, to engage them and to pursue some of the non-clinical passions like clinical research, teaching and various other things which we do. I think we need to work on those things which we are working around for that. Yeah.
Thank you, Doctor. And I think we're out of time, so I just wanted to kind of summarize, I think 3 takeaways again, and we'll probably keep the trend of 3 takeaways for the rest of the day. I think first is definitely what you said, how do I bring meaning? So meaningful work. The second was, you spoke about the positive work environment. I think these are universal learnings. Obviously, the conversation in your context is one of patient and staff, but I think a similar conversation in terms of customer and stakeholder. I think the positive work environment which is created by all stakeholders. And finally, trust. I think trust is something, obviously, I think a lot of us have lost, based on the conversation I've had, but it's coming back, right? Trust is coming back, and trust is coming back in all manners of working. Even people, you spoke about people who kind of collaborate in a hybrid work environment. You have 5 people in the room, 5 people outside the room. How do you still have trust, right? So I think all of those learnings are really helpful. So thank you, Doctor. Thank you for your insights.
This is, trust is either 0% or 100%. It's, you cannot say I trust somebody 50% of it. It's either you trust or you don't trust. And that is where the challenge is for the organizations to create an environment for people to trust you. That is the most important thing.
Perfect. Yeah. Great way to close the conversation. Thank you, Doctor. I think we'll just close with trust and we'll close it there. Thank you.